Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. I've worked remotely for over 9 years in utilization review, and I've worked for 3 different major insurance companies. And the goal of my channel is to help nurses pivot from the bedside to remote work. Payor Health is hiring a nurse navigator. This job is full-time. We have 2 positions available. One is day and the second one is overnight. The first job is full-time. 2 openings are available, 4 days a week, 7:45 a.m. to 6:15 p.m. Eastern Time, or 12:45 p.m. to 11:15 p.m. Eastern Time. You'll work every other weekend. That's required. You must have an RN license and a compact RN license. Now I go straight to the qualifications, but even if you don't meet every qualification, I still suggest you apply. They want you to have 2 years of clinical hospital experience. It's highly preferred to have ICU or ER experience, a compact RN license, at least an associate's degree in nursing. If you are bilingual in English and Spanish, add that to your resume, and ability to give and receive actionable feedback. I'm going to skip these bullet points, and this job pays 33 to 36 an hour. The next job, which is overnight, this job also requires you to have an active compact RN license. You'll work from 10:45 p.m. to 9:45 a.m. Eastern Time, 4 days a week, rotating days. Every other weekend is required. And this job has the same exact requirements as the previous and the same exact pay, which is 33 to 36 per hour. Corvel is hiring an Advocacy 24/7 triage nurse. The job is also full-time. You must reside in a compact state. Your internet upload and download speeds must be at least 80 megabits per second. They want you to have at least an associate or diploma in nursing. A BSN is preferred. A current RN license in a compact state. 3 or more years of clinical experience in occupational medicine, urgent care, ER, or home health. And they do require microbiology. Maryland Physicians Care is hiring a care manager. This job is full-time. They want you to be an RN in a current state. You must have 2 years of managed care experience. This is actually preferred. Experience with pediatrics, NICU, postpartum, or maternal health is required, and it's preferred to have a BSN. Brighton Health Plan is hiring a clinical appeal nurse. This job is full-time. Here it does say experience. You must be an active, unrestricted RN or LPN, 5 years of clinical appeals and grievances within the managed care or payor setting, 5 years clinical experience across various settings. That includes acute, inpatient acute, SNF, LTAC, ARU, outpatient, DME, or complex care. Blue Cross Blue Shield of Kansas City is hiring a clinical nurse, case and disease management. This job is full-time. You must have at least an associate's degree in nursing, 3 years of full-time direct patient care clinical experience in either transplant, oncology, or med-surg, ability to effectively present information and respond to questions from groups of managers, clients, customers, and the general public. Personify is hiring a utilization review nurse. This is for LVNs, LPNs. This job requires you to have an LVN license in the U.S. or U.S. territory, and only 1 year of clinical experience is required. And you can read this information here at your leisure. And also make sure you add Microsoft Office to your resume, as well as any software or platforms you currently work on and at your current job and your previous jobs. So that includes Epic, Cerner, Meditech, Protouch. This will make your resume more tech savvy. Parkland Health is hiring an RN Care Coordinator Utilization Review. This job is PRN. It is remote only, PRN, and shift is any, and work hours are as needed. You must have 2 years of hospital or community-based patient care nursing, preferably in an assigned clinical area. You must have an RN license in the state of Texas or a valid compact RN license. And they want you to have a BLS for healthcare providers. Machinify is hiring a nurse itemized bill reviewer. This job is full-time. You must be an LPN, LVN, or RN in good standing, 1 year or more of itemized bill review, 2 years in healthcare billing and coding, experience applying payor policies and national coding guidelines such as CPT, ICD 9 or 10, and HCPCS. I'm going to skip some of these bullet points. Also, make sure you have Microsoft Office on your resume. And one more thing about Machinify, they are a work from anywhere in the US company. Machinify is digital first. The next job with Machinify is a quality assurance supervisor. This is clinical RN. This job is full-time. The pay is $95,000 to $105,000 per year. You must have 3 or more years of diverse nursing experience providing direct care in an inpatient or outpatient setting, a current unrestricted RN license, not currently sanctioned or excluded from the Medicare program by OIG. Care Oregon is hiring an RN care coordinator telephonic, pediatric, and maternal. This job is full-time. The pay is $100,350 to $122,650. You must have an active, unencumbered Oregon RN license with at least 2 years experience in the healthcare industry. And they prefer you to have a BSN if you have it. And if you have any experience in pediatrics, perinatal, home care, advanced illness, palliative care, hospice, primary care, and or case management. Tri-West Healthcare is hiring for a clinical quality reviewer, RN. This is for not only RNs, but also licensed clinical social workers. You must also have 3 years clinical experience, med-surg, or behavioral health. Here are the preferred qualifications. And also, I do want to mention right here where it says interqual. If you go to the description box below, you'll see a link that will take you to a website called Cure to Bedside Burnout. From that website, if you're on your computer, you'll see at the very top of the screen resume tips. But if you're on your cell phone, go to the very bottom of the screen, you'll see resume tips there. From resume tips, a new screen will appear, and you'll see if towards the bottom of the screen where you can go to get interqual certification. Sedgwick is hiring a utilization review nurse, RN. This job is full-time. They want you to have at least 4 years of related experience and are equivalent to combination of education and experience required to include 2 years of recent clinical practice or 1 year of recent utilization review. Northeast Georgia Health System is hiring an RN clinical documentation specialist, CDIP or CCDS required. This is weekdays, remote, full-time, 8-hour shifts. They want you to have an RN license in the state of Georgia, at least an associate's degree in nursing, and 5 years of practice in professional nursing. And here are the additional preferred qualifications, but are not required. And just a FYI, make sure that whenever you're creating your resume, focus on these 3 things: what you did, why it's important, and how it relates to the job that you want.